CURES, mandatory consultation. California law requires that physicians consult the Controlled Substance Utilization Review and Evaluation System database before prescribing controlled substances. This law is found in California Health and Safety Code, Section 11-165.4. Physicians must consult the CURES database and review the Patient Activity Report, PAR, which presents the patient's controlled substance history for the past 12 months before prescribing a controlled substance. CURES is California's Prescription Drug Monitoring Program, PDMP. CURES is a database of controlled substances dispensed in California, Schedules 2 through 5. What is a PDMP? The CDC, Centers for Disease Control and Prevention, defines PDMP, Prescription Drug Monitoring Program, as an electronic database that tracks controlled substance prescriptions. The 2016 CDC Guideline for Prescribing Opioids for Chronic Pain recommends the use of prescription drug monitoring programs, like California's CURES. The California Attorney General has announced that CURES consultation is mandatory under Health and Safety Code Section 11-165.4. The Medical Board of California has also announced that CURES consultation is mandatory for the prescription of controlled substances Schedules 2, 3, and 4. When should CURES be consulted by a physician? The first time and at least every 6 months. The first time, before prescribing a controlled substance to the patient for the first time, a physician must consult CURES. And at least once every 6 months thereafter, if the physician renews the prescription and the controlled substance remains part of the treatment of the patient. The physician must review the Patient Activity Report, PAR, and review the past 12 months of controlled substance history for Schedules 2, 3, and 4. The Patient Activity Report must be obtained from the CURES database no earlier than 24 hours or the previous business day. Documentation. The Medical Board of California recommends that physicians note the CURES consultation in the patient's file. Alternatively, the physician can print the report and place it in the patient's file. Exemptions. Subdivision C of the Health and Safety Code, Section 11-165, provides exemptions to the CURES mandate. One prominent exemption is the terminally ill patient. CURES consultation is not required for terminally ill patients. A terminally ill patient has an illness that is incurable, irreversible, and the patient is not expected to live for more than 1 year. And the controlled substance prescription is for the control of pain and symptom management. Terminally ill is an exemption under Subdivision C of the Health and Safety Code, Section 11-165. Subdivision C also provides another exemption for use while on facility premises. Controlled substances that are to be administered to a patient in a designated facility, for example, a hospital, for use while on facility premises. Under this exemption, CURES consultation is not required. So if the controlled substance is being administered to a patient in a hospital or other designated facility for use while on facility premises, CURES does not need to be consulted. And Subdivision C provides 6 categories of designated facilities. Subdivision C also provides 3 categories of exemptions where a 7-day supply of controlled substances, non-refillable, is acceptable. The first category is surgeries. Surgical, radiotherapeutic, therapeutic, and diagnostic procedures are exempt. Emergency departments. An emergency department in a general acute hospital is exempt. And the third category is when CURES cannot be accessed or the situation would adversely impact the patient's medical condition. Under these 3 categories of exemptions, a 7-day supply of controlled substances, non-refillable, is acceptable. Physician must document the reason for the exemption in the patient's medical record. Sanctions. Physicians who fail to consult the CURES database shall be referred to the medical board for administrative sanctions. Registration requirements. All physicians with a California medical license and a DEA registration certificate must register for access to the CURES database. The Office of the California Attorney General provides publications and training, such as webinars and detailed instructions on how to register and use the CURES website. In summary, California law requires that physicians consult the CURES database before prescribing controlled substances. References and resources are provided here.